Hello, my name is Carrie. I'm a Texas State nursing student. I'm here to do a head-to-toe assessment. We have a 45-year-old African-American male. I was going to ask you if the room feels comfortable or if you need a chaperone before we get started.
The room feels comfortable and no need for a chaperone.
Okay. I'm going to wash my hands. So I'm going to start by palpating your scalp, and I'm looking for any tenderness or any lumps or lesions. His scalp is symmetrical, hair is evenly distributed, it's warm and dry, normal for ethnicity. His ears are midline, his nose contours nicely to his face. His lips are slightly darker color than the shade of his skin tone. Do you have any tenderness here on the frontal sinuses?
No, ma'am.
And maxillary?
No.
On a corpus? Any tenderness there?
No.
There?
No.
Any tenderness here?
No.
And what about here?
No.
And there's no deviation of the septum. I'm going to touch your eyelids. Any tenderness here?
No, ma'am.
Eyelashes are evenly distributed. And what about any tenderness on your ears?
No, ma'am.
No? Okay. Ears are midline, no tenderness noted. I'm going to start by doing a cranial nerve 5. Can you feel this?
Yes, I can.
Cranial 5 is intact. Can you raise your eyebrows for me? And can you frown? And puff out your cheeks. Cranial nerve 7 is intact. Can you push your tongue against my hand on each side? Very good. And then I'm going to have checked your 6 cardinal fields of gaze. This is cranial nerves 3, 4, and 6. Cranial nerve 3, 4, and 6 intact. And then I'm going to look in your eyes. Pupils are equally round and reactive to light and convergence and response. I could see the iris, retina, optic disc, and red light reflex. And again on this eye, I can see the retina, optic disc, red light reflex, and vessels. His sclera is white. The conjunctiva is pink. I'm going to also look in your nose. I can see the turbinates. They are glistening in pink. Can you close your nose and blow out? And that's cranial nerve 1. It's intact. If I had something for you to smell, like lavender or something like that, I could let you smell that. And then can you stick out your tongue for me? And move it side to side? And can you say ah? Uvula is midline. I can visualize the hard and soft palate. 32 teeth intact. Teeth are ivory. Gums are pink. Buccal mucosa is moist. And then now I'm going to palpate your lymph nodes. So we have the pre-auricular, the tonsillary, and then we have the submandibular, submental, post-auricular, occipital, superficial cervical, and then we have the deep cervical and the superficial cervical. We have the subclavicular nodes. They're not palpable. Any tenderness on those areas?
No, ma'am.
Okay. And then his neck is midline. Can you swallow for me? And then I cannot palpate the thyroid. When I looked in his mouth, his tonsils were +2. There was no swelling of the tonsils. Can you shrug your shoulders for me? This is cranial nerve 11 and it's intact. And then open your mouth for me. This is any clicking or popping?
No, ma'am.
Okay, so TMJ is not noted. I'm going to do a test called the whisper test. So I'm going to step to one side and whisper, and then you can repeat after me. This is testing cranial nerve 8. 6.
Yes. 7, 8,
And again on this side.
6, 5.
Okay. And solo for me again. Okay. So everything looks good. I'm looking at him. He's sitting symmetrical. There's no signs of deformity. His skin temperature is warm and dry all the way down his arms. And now I'm going to look in your ears. And so for an adult, you pull the peanut up and back, and for a child, it's down and back. So I'm looking in his ears, and I could see that it is shiny and gray, and the tympanic membrane is visualized. And then on this side, the tympanic membrane is shiny gray and visualized. Okay, I'm going to have you lie down, please. And so I'm going to listen to his heart and abdomen and lungs, and I'm going to use the diaphragm and the bell of the stethoscope. This is the pulmonary. Aortic, pulmonic, Herb's point, tricuspid, and mitral, which is the point of masculine impulse. And then again with the bell. This is pulmonary, aortic, pulmonic, Herb's point, tricuspid, and mitral. So I heard S1 and S2. There was no heaves or thrills. Any tenderness on any place on your chest?
No, ma'am.
His neck is warm and dry, normal for ethnicity. So I'm going to have you raise your shirt for me. Okay, and I'm going to have you tilt your head up, raise your head for me. Okay, and so I'm looking at his skin tone. It's normal for ethnicity. There is no lesions. There's no evidence of herniation. I don't see any pulsations. So I'm going to listen to his abdomen with my diaphragm and the bell in all 4 quadrants. Bell sounds auscultated in all 4 quadrants. So now I'm going to I'm going to listen to the aortic, renal, and iliac. And then I'm going to palpate your stomach. Any tenderness here?
No, ma'am.
Any tenderness here?
No.
Here?
No.
And a little here?
No.
And then this is a little deeper palpation. Any tenderness?
No.
Here?
No.
Here?
No. No, ma'am.
Okay, and then I'm going to see if I can palpate the liver. Liver is unpalpable. And then the spleen. And I can't palpate the spleen. Okay. And then I'm going to do some percussion. being noted over the abdomen. And then I'm gonna feel for the femoral pulses and inguinal nodes. And then the radial pulses, +2 and +2. And then the brachial pulses, those are +2. And then I'm going to feel the carotid pulses. And those are also +2. And then I'm going to feel your axillary nodes. Any tenderness there?
No, ma'am.
Okay. And then I'm going to go ahead and feel the pedal pulses. Those are +2. And +2. And popliteal pulses. Those are +2. So I'm looking at his skin on his legs. The hair is nicely distributed. There's no signs of edema. Skin tone's nice on his feet as well. No edema noted. I'm going to do some range of motion exercises with you. And let me know if you feel any discomfort. Any discomfort with that movement?
No, ma'am.
And then this side. Any discomfort there?
No, ma'am.
Okay. And then I'm going to have you sit up on the edge of the bed for me. I forgot to do the conduction hearing loss test. This is the Weber test. This is to see if you can hear that when it's placed here. Can you hear it on this side?
Yes, ma'am.
Okay. And then, so I'm going to look at his hands. His hands are nice and dry. Skin's evenly distributed. Nice skin tone. Nails are nice. There's no evidence of clubbing or splitting. Capillary refill is less than 3 seconds. And this side too, nail beds are pink, no clubbing, nails are distributed nicely. I'm going to have you face towards the wall so I can listen to your lungs. So I want you to say 99.
99.
And 99.
99.
Okay. And again here.
99.
Okay. And take a nice deep breath. So lung expansion is good. There's no use of accessory muscles. No respiratory distress. And so when I place a stethoscope, I want you to take a nice deep breath. And then I'm going to listen here laterally. So there's, his lungs are clear, there's no signs of crackles, bronchi, wheezes, or any diminished lung signs. Okay, and then I'm going to have you sit at the edge of the bed. Okay, so I'm going to check your reflexes. So turn your hand this way. And so this is the radial. And then we have the brachial. And then turn your arm this way. Relax. This is the tricep. And actually this was not the, it was the bicep. Okay. And then we have the brachial. Okay, and then we're going to do the tricep. Okay. And then I'm going to check your patella reflex. And then this side. Okay, and then the Achilles tendon reflex. And this side. And then the Binsky. Okay. And so when I'm looking at his feet, there's no edema or anything. So I'm going to do some strength exercises and see what your range of motion is. So can you tilt your head back and then forward? Any pain or discomfort?
No, ma'am.
And then side to side. And then resist against my hand. And then again on the side. Okay. And then squeeze my hands. Okay. And then push down. And then pull up. And then can you do your arms like this? And can you rotate your shoulders? Okay. And then can you push down? And then pull up? And then pull towards you? And then push towards me? Okay, any discomfort or pain with any of those movements?
No, ma'am.
Okay. And then I'm gonna have you do your hands like this and resist. Okay, very good. And then I'm gonna have you stand for me. And then I'm gonna have you bend over this way. I'm gonna touch your spine. So his spine is symmetrical. Cervical, lumbar, and thoracic spine are intact. Any discomfort with any of those movements?
No, ma'am.
Okay, and stand up for me. And can you bend backwards? And then forward. And then can you hold out your arms like this and close your eyes? This is the Romberg test. I would stand with him to make sure he does not sway in any way. Okay, you can open your eyes. And can you touch your nose? Very good. Okay, now I want to assess your gait. Can you just walk normally? And then come back towards me. Okay, and then walk heel to toe. Okay, and then walk on your tiptoes. Okay. All right, and then come back on your heels. Okay, and can you do rapid hand movements like this? Okay. And are you able to do your heel down your shin on each side? Very good. And I think that pretty much concludes our test. Do you have any questions for me?
No, ma'am.
All right, thank you.
All right, thank you.
Thank you.